Welcome, everyone. Thank you guys so much for joining us tonight for multiple sessions, for joining Sasha and I for this session. We're going to spend a little bit of time talking about the stuff that we love to do every day. We're really going to be focusing on facial rejuvenation. Before we get into that, we both just want to take a second to express our gratitude first to you guys, our patients, and also to our entire staff. These events are hard to put on. They take quite a bit of work. We are incredibly proud of our staff here. If you have been here before, you know we put a lot of emphasis on culture and the people that are here, and we're proud to work with these people every day. We want to thank the people behind the scenes, the providers that were on camera tonight. We want to give a special shout out to Jennifer and Madison of our marketing team. It's really a lot of work, and to make something so seamless, it really takes effort. So thank you. My name's David. This is Sachin. So we started this practice over 10 years ago, really with just focusing on two things: trying to provide really high-level outcomes, and focusing on also providing excellent patient care. And that credo has been our kind of driving force throughout this entire process. And you know, really at this point, what we boiled it down to is building trust through trying to provide unparalleled aesthetic outcomes and experiences. And that concept, that statement, is something we talk a lot about as a team. You know, we really try and wake up every day and try and do a little bit better than we did the day before. And that comes down to not just patient care, but also some of the surgical outcomes and techniques that we've evolved that we're going to talk about. So again, if there are questions, please feel free to drop them in the chat, and we'll try and get to as many of them as possible. Also, please take advantage of the discounts for tonight, the skincare discounts using the Fall Into Beauty or FID 2022 code, and also the Beauty Bank credits. Great way to get some credit if you're planning any of these non-surgical services in the next 12 months. Good.
Yeah, that's great.
Yeah. Okay, so we're going to really focus on our kind of signature procedure, which is our face and neck lift. And really what this is it's a fundamentally a deep plane face and neck lift that over the last 10+ years, we have spent all this time trying to make as good as possible in our hands and adapted for each individual patient. And when you do that, some of the little techniques and nuances start to evolve, and it is founded as a deep plane face and neck lift, but there are certain components of the surgery that really have just evolved in our hands. That's partly what we're going to talk about tonight. So I think fundamentally, it is a very methodical surgery. A lot of people come in concerned about how do you know that you're going to be delivering a natural and high-level outcome. And the truth is that if you know how to follow these steps and you're efficient with your hands and your motions, and you know how to understand this anatomy, you're always going to deliver a really natural, nice-looking outcome. But if you want to go a step further, then you're going to be really tailoring each component of the surgery to the individual that you're treating. And you're going to use these nuances or these individual techniques that we've kind of been thinking about and refining to really take our outcomes to the next level. The third point on the slide, I think, or how can a facelift look natural? I like this concept of one of the main thing that we're trying to address is soft tissue that is falling. And if you do this surgery right, and I'll use some photographs to show it, all you're doing is taking that soft tissue, that deeper soft tissue, and replacing it in its more youthful position. You're never taking tissue and moving it to a new location. That's how you have a setup for an unnatural outcome. If you're just following that fundamental restoration of volume back into its more youthful position, you're already set up for a more youthful outcome. And really, that's why we focus on the deeper structures during this lift, is because that's really what's descended. The skin follows the deeper structures. The skin is not the primary substrate of aging. It's really the deeper structures that matter. technical help. Okay. I also just want to mention that really hone in on this idea that the skin is a secondary component here. An afterthought. It's really an afterthought. But I mean, we're concerned about it. We want it to look good, but it's not what should be the primary component of what we're addressing. In a deep plane face and neck lift, you're really focusing on the soft tissue of the cheek, the soft tissue of the lower face of the jowl, and the laxity in the neck musculature. And you're working to restore all those deeper structures in there to their more youthful position. But it's also important to look even deeper in the right people. Some people have presentation of the buccal fat here that's showing or contouring in a way that it didn't when they were younger, where they have fullness in the neck that's not just about skin and muscle laxity, but it actually can be from gland laxity or deeper fat laxity or even some deeper musculature. And I think you need to be comfortable working in each one of these levels in order to contour really from deep to the superficial in order to achieve these high level outcomes. I think tension management, it's interesting to start with a male. It's a really handsome guy, but I think tension, making sure to avoid that windswept, that unnatural look is important to everybody. I think it does become important, especially in our male patients, our male consultations, because a lot of the men we talk to are pretty terrified of some of the stigmata of face and neck lift, some of the really telltale signs. And so if you're going to be doing lifts on men, and women, obviously, you need to be comfortable managing tension, getting rid of all the signs of laxity and aging, but really showing no signs of tension. And then I think the last thing I want to talk about for this particular procedure is the neckline and the jawline. And I think fundamentally we are nerds, and we spend a lot of time thinking about some of the physics here, angles, vectors, tension lines, really trying to optimize neck and jawline. And if you ask what a neckline is, I don't think it's totally clear right off the bat. Most people, when they think about a neckline, are thinking about the right angle or the shadow under the chin, kind of where the double chin might exist. So someone in profile, and here in this photo is represented as angle 1 and angle 2. Creating that angularity, that definition, that refinement there is incredibly important. But actually, probably the harder shadow to create is angle number 3. And this part of the jawline called the angle of the mandible, or the lateral mandible, creating that shadow or that right angle on angle 3 there is one of the things that we spend a lot of time refining our techniques in order to show. And some of this is determined by somebody's natural bony structure, but some of it's also determined by the way that we manage the soft tissue in the deep structures, in the muscular way, and the way that we manage tension and redraping, really trying to accentuate that shadowing out there. And I think a lot of people know this beautiful woman. She's our COO here at LNP Aesthetics, Yolanda. And this is a beautiful outcome, and she obviously started in a great place too. But when you look at the jawline on profile, you'll see that right angle, angles 1 and 2. But you're also going to see that shadowing out here by the lateral mandible. And I think it's a neglected area when people analyze necklines and jawlines. I think it is a place where you'll see, I think we see people come in who have had surgery where they didn't quite get the result they wanted there and are looking for revision surgery. But I think it's an area that you need to focus on and you need to be able to manage if you're trying to get this type of outcome. Before I move on from her, and I'm almost done, I'm going to turn it over to him. I do want to talk just about what makes deep plane face and neck lifting unique. If you look at the 3/4 view on the left side of the screen, you'll see that in the pre-operative photograph, a lot of the volume of the face had descended or dropped to the area kind of by the mouth. So most of the soft tissue volume is sitting there by the mouth. And back here by the ear, it's kind of relatively thin compared to that frontal. And in a deep plane face and neck lift, what you're doing is releasing, mobilizing that descended deeper stuff so that it can be restored to its more youthful position. You get a better distribution of the volume of the face. It looks more youthful, it looks more kind of naturally energetic. And you're not separating the boundaries between the cheek and the lower face and neck because they're really all moving as one unit. This is just another great example. A beautiful young woman who was just bothered by that loss of definition around the jawline. But I think it's a great example if you look at her profile view of those three angles, those three areas where we think about what a true neckline really is. So these are just some other highlights. I guess the last thing I want to say is one of the things about this surgery, if you do it right, is that a lot of our patients will come back and say, I don't really remember what it used to look like. And that can be from subtle changes, really, subtle refinements, or more significant rejuvenation procedures. And it's not until you actually put the before and the after up that you see the drama in the before and after. And I think what that should say is that if you're restoring these contours and definition, but it looks natural on that person, then people just look forward to the future and they don't really think about the way that it presented in the past. It doesn't catch their attention. They kind of forget about it. It's when you look at the before and after, you say, oh, wow, I sort of forgot that's where things were. And in some ways, that is a great way to look at what a natural outcome is that it feels like it fits that person so well that it's easy to forget how things were in the past.
Okay, thank you, David. Some wonderful concepts that I think him and I have definitely thought about every day for the last 10 years. And I think we both wake up every day and try to figure out how we can perform all of these procedures better. It's kind of one of the fundamental tenets of our practice and how we try to improve what we're doing. I'm going to spend a little time talking about supplementary and complementary procedures to deep plane facelifting and neck lifting. And the first one I want to talk about is fat transfer. Fat transfer, also known as autologous fat transfer, is essentially when a patient, when you redistribute that volume that David was just talking about to its more youthful or natural position. But if a patient is not starting with enough volume, they need supplementary volumetric change. Now, I know some of our teammates have talked about adding volume in the office with different dermal fillers or collagen stimulators or collagen stimulating heat-based treatments. But in the operating room setting where David and I spend a lot of our time, when we're thinking about adding volume, we are thinking about taking fat, usually from the abdomen or the inner and outer thigh. We purify that fat. We take it out using a liposuction technique, but we purify that fat using a really nice proprietary technology called PureGraft that keeps that fat stem cell rich, and then we inject it back into the face. It's important to understand that fat transfer is not just about volume, soft tissue replacement. It is also about bony changes, bony loss. We have bony loss as we age. Our bone in our jawline and our cheek gets thinner or you lose it. It's about bony asymmetries. It's about different structural abnormalities that a patient may have. So it's all encompassing when we're thinking about a fat transfer. In addition to that, we take the face and we'll think about it in multiple subunits. We'll use the word cheek, but in our mind, a cheek is made up of 4 or 5 different areas. We're thinking about the anterior cheek, which is the front part of the cheek, the malar eminence, where you would put blush to give you contour highlight, the lateral cheek or zygomatic arch. We're framing the eye when we're adding volume. We'll often think about volume around the nose or the mouth area. So it's a really nuanced concept when we're thinking about volumetric change and using stem cell rich fat transfer or fat to bring up that volume. Now, this is a great case, and this is a case that's probably familiar to a lot of people that have been around our practice and seen this picture. If you really look at the patient and the left, and if you were to just redrape skin and muscle volume to its more youthful position, you can kind of envision that wouldn't have been enough. The volume was critical in her result and her rejuvenation. It created a softness to her entire face. It really framed her eyes. it was imperative to think about volumetric change, especially, this is an extreme example of someone who's had lots of sun damage, lots of volume loss over time. But the complementary procedure of fat grafting with facelifting is important. In our practice, we probably do or offer fat transfer, 30 to 50% of the time, probably closer to the 30% number. If someone has good large cheekbones, not something that's on the forefront of our recommendation list. We have two different, kind of categories of fat transfer or fat, fat replenishment, kind of a limited amount, which is a small volume, and then more of a full fat transfer on a patient like this. Another supplementary or complementary procedure to a deep plane facelift and neck lift is thinking about your skin. Laser resurfacing is the first thing I'm going to talk about. So we think it's very important for our patients that take the time to invest the downtime, the decision to undergo a procedure like a facelift and neck lift, to think about longevity and longitudinal planning. And part of that, what's so important, is how is your skin going to frame into that longitudinal plan after everything is redraped? And you can address your skin in many ways. In the operating room setting, we're usually talking about laser resurfacing, because laser resurfacing has a downtime that matches the facelift downtime, which is 10 to 20 days. And if someone is thinking about a more aggressive kind of skin cleaning, a laser resurfacing is a good complement. The laser that we use in our practice is a TRL laser, the tunable resurfacing laser that's fully ablative, that's going to really tackle texture, fine lines, sunspots. Those deep lines that you see around the mouth, the textural changes or the crepey changes around your eye. In addition to that, if someone's not ready for a longer downtime that comes with laser resurfacing, we will have an alternative procedure, usually a medium depth chemical peel. A chemical peel is usually a form of an acid that's designed to penetrate kind of the deep skin, or the dermis, which is right under the skin layer, that middle layer. And that medium depth peel is going to help stimulate collagen, lift up some of the sun damage, and help tackle the fine lines and wrinkles. We take it to, we think about it the next level, and I think one thing that we've introduced in our practice is not just these two resurfacing modalities, but another concept is nano fat transfer. Nano fat transfer is like very, very processed fat that we will harvest from the abdomen or the thighs usually. And we use that same technology to make it really fine and silky, but hold on and keep those stem cells alive in that fat. And what the literature shows is that when that is injected into the face, you can inject it for some of those tough textural lines. It actually helps the skin overall. It gives it a nice radiance. So those are, three procedures that we will think about complementing for the skin, complementing our facelift with. And just like everyone has talked about today, I think you have to build a longitudinal plan, whether it's Moxie, Morpheus, broadband light, to kind of to enhance or maintain your result for that skin through time. Here's someone who did a laser resurfacing with a deep plane facelift and neck lift. She also had some nice volume added to her chin. And you can really see how smooth the under eye skin and the skin around her mouth looks. I want to talk a little bit about revision facelifting. So revision facelifting, of course, you want to do it right the first time and hope to never have to have this surgery again unless, it's 7 or 10 years later. That's probably the longevity of a lift, but not because something doesn't look right or natural. Dave and I spend a lot of time consulting with patients that are coming in for revision facelifts at outside institutions. We're coming upon 10 years now. I'm sure we're going to start thinking about some of our own early patients that may want to get relifted because the longevity of what they had is starting to kind of diminish. It's important to think about the challenges and each individual problem we may face when we're evaluating a patient for a revision facelift. In 2022, it's not just about either surgery time frame running out or a poor result from the first surgery. It's also thinking about some of the supplementary or complementary procedures that have been mentioned tonight. Now, we support all of those energy-based treatments. They're great for the skin. They're great for maintaining youth. They have become very popular in this day and age. What we know is that those procedures also do change some of the microvasculature under the skin. That skin is not going to particularly maybe heal the exact same way if it's been through multiple rounds of heating over a 10, 15, 20-year lifetime. And I think that's important for us as surgeons to point out to patients, to talk to them about what we expect when we know a patient has gone through several of these things. They're great procedures. They should be done to a certain extent. And I think our team, us, can guide you so that you're not overdoing it when it comes to some of the supplementary or complementary office-based procedures. But there are different challenges that we in the facial plastic surgery community are noticing now that there's been a 10, 15-year life of some of the original heat-based treatments like Holt therapy and Thermage and others. So revision facelifting, I think there's just a different, more of a thought put into what we're encountering and what to expect when we actually, go into the face and start doing the work that we're going to do. This is an example of a revision facelift. This patient's issue really, she's, I think she's almost in her 70s and she looks fantastic. More about redistributing that volume, getting rid of some of the aging changes around her face and some of that very small laxity preoperatively that she had in her neck. This is also a revision case. She had multimodality treatment where she had a nice shortening of the lip, and you can see that nice volume at the posterior jawline. Some more complementary procedures that we have in our practice that we will recommend with a facelift and neck lift usually are upper and lower eyelid lifts, lip lifts, endoscopic brow lifts or temple lifts, chin augmentation for patients that have underdeveloped chins, where adding a little bit of volume accentuates or elongates the jawline to make it look more elegant. So those are just some of the other adjunct procedures that are usually patients come in asking about, or if it's brought up, then we recommend it. This is a patient that had multiple procedures, and it's a wonderful result. Like David was alluding to at the conclusion of his portion, you forget what the before was when the patient lives in that after picture. But you can see she still presents like a 60-year-old beautiful woman, but that she's just a much better version of the original 60-year-old, and maybe 72-year-old that she is. Okay, I am going to move on from some of the fine nitty-gritty science stuff and talk a little bit about the future ahead. As many of you know, a month ago today, we opened our second location in Los Gatos. So L&P Los Gatos has been open for business. We're going to introduce some special people that are in charge of that very great location right in downtown, next to 3 Michelin star Manresa restaurant. So we encourage our patients down in the South Bay, Monterey, Carmel, to definitely check out the L&P Los Gatos. In the spring of this upcoming year, we're going to be expanding in Palo Alto, and we will be opening a location that is all based on skin and regenerative medicine, and that will be another 6 treatment rooms and more retail and great estheticians like Sid and Colleen to help you through that journey. And that should be opening up in the spring of next year, 2023. Some of the therapies that we plan to offer, we think of this as a place where you can get ready for that red carpet event, that charity benefit, that gala, where you come in and you get the, L&P facial, that secret sauce. And in addition to that, we're going to have some collagen stimulation treatments, infrared and red light therapy, stem cell therapy, in addition to our medical grade skincare. By popular demand, and the literature supports this, hyperbaric oxygen treatment, I think, will supplement not only our facelift healing, but every other surgery or laser resurfacing or energy-based treatments. We're also going to have PRP, which is platelet-rich plasma and platelet-rich fibrin treatments, and then the Diamond Glow facial and some other new technology there. So we're really excited about that long-term wellness, regenerative medicine aspect that we hope to add to our practice. I want to bring in a guest. He's in the room. This is another facial plastic surgeon that has joined the team. Hopefully the camera can fit him. Madison's going to move it back. This is Dr. Curdy. Dr. Curdy joined our team a month ago. We know Dr. Curdy very well. He was at L&P about 2 years ago as our facial plastics fellow. So we were just so impressed with his work ethic, the way he treated patients, his personality. personality, his surgical skills, his eye for his technical eye, his artistic eye. We wanted to bring him back. So Dr. Purdy is the medical director of LMP Los Gatos, and we are really, really honored, excited to have another surgeon join Dave and I. We can't wait to kind of grow our techniques, learn from each other, share ideas, and augment some of our techniques. Thank you, Madison. Oh, so I know there's some questions on facelifts, and I'm going to answer those now. Since I introduced Dr. Purdy, we'll let Dr. Purdy take the first question, which was, do you offer any type of mini lift?
So yes, I do offer a mini lift. I think there's a time and a place for different types of facelifts. You know, in addition to the LMP signature deep pain face necklace that you guys have been talking about for the last 30, 45 minutes or so, I think there's going to be a certain patient population or a certain group of people who would benefit from a mini lift, and that's something that I'd like to help grow as a part of the practice.
Can a mini lift be done? What setting is a mini lift done? Is it done in the operating room? Is it done in the local? Can you talk a little bit about that?
Yeah, so you know, it depends. It depends a little bit on patient comfort, but it's actually something that can be done in the office or under local anesthesia, especially for, you know, we have certain people who are unable to undergo general anesthesia, whether that's for medical reasons or just fear of anesthesia, and a mini facelift is something that can be done in the office under local.
It's definitely it's an appealing term. Dave and I get a lot of questions about the mini lift. We often are like, we have some opinions on it. We talk about the advantages and disadvantages. If you're, you know, I encourage you to set up a consultation with Dr. Purdy so he can talk to you in detail, because I think it's very specific to one's anatomy and the outcome that one's expecting. Okay, next question.
What if I just want a neck lift? Is that possible? This comes up a lot. Sometimes is the answer. The reality is if in the right candidate, some of it's based on age, some of it's based on type of laxity, people that really have isolated volume laxity, somebody who has more advanced soft tissue laxity that includes the mid face and lower face, doing an isolated neck lift tends to be a very unsatisfactory outcome, because you're creating a really rejuvenated look in one part of the presentation, but then you have a different look in the face, and that kind of junctional look can draw attention in a very negative way. That being said, there are people that have laxity that's focused more on the neck. They tend to be, I would say, you know, say someone in a really younger population with a double chin, but even people in their 30s, 40s, that have more minimal laxity in the lower face, where we're going to do what we call a midline neck lift, which is really starts with a deep neck lift, so contouring some of the deep neck contents, what we call an extended platismoplasty, using some of our suture techniques to create sharpness in the muscular layer, maybe contouring some of the fat above the platisma with liposuction. We'll often add something like our radiofrequency treatment, face tight, neck tight, to create some skin tightening and some tightening of the soft tissue in the lower face. And you know, some people will also complement this procedure with, say, buccal fat contouring, or maybe chin augmentation, or fat grafting to the upper face. There are things you can do to really create a whole picture and nice outcome. But the reality is, a lot of people who come in with global facial soft tissue laxity are not going to be candidates for neck lifts alone, even if the neck is what bothers them the most. Because I think our main priority is, if we're going to move forward with offering surgery, we want to make sure we're making smart decisions, or what we think are smart decisions for the people we're treating. And you know, I think the consultation is something we take really seriously. We're trying to really understand what someone's goals are and really communicate what we know and what the knowledge that we've built up, so that we can come to a really mutually agreed upon plan and set appropriate expectations. And that's where a lot of this happens, is either the pre-consult or the consultation, talking about, you know, complicating and interesting questions.
Is there scarring? One of the questions we had, is there scarring behind the ears? Can you have short hair? So, great question. I like answering this one. Whenever you make an incision, there will always be evidence of that incision. The goal is to try to make that incision disappear as much as possible. But if someone is looking very closely with 4 times magnification, you can always find it. Now, we place the incision in the natural curves and shadows around the sideburn hair and the curves and shadows within the ear. It then kind of comes on the back of the ear bowl and down the hairline. It's usually placed a couple of millimeters behind those stray hair follicles in the back of your hair, behind your ear. If you have short hair, we've operated on bald men before. It is not an issue. It's all about making sure that there's no tension on the skin. So all the tension is placed on the deeper layer in a natural vector. And then that skin has no tension on it. And then in addition to that, it's closed meticulously. That's what it really comes down to make sure that that incision hides as much as possible. But we've had patients with no hair, we've had patients with short hair, and we've had patients with long hair that like to put their hair up when they work out, or it's their personal preference. And our goal always is to make sure that that scar is, that incision is very hard to see. If you come in for a consultation, or if you go on our website or Instagram, I think there's some close-up pictures of what the incision looks like after it heals.
So I heard 40 is too young, 50 is just right, and 60 is too late. True or false? I mean, it's true and false depending on the person and their preference. So, for example, we'll start with the first one. Is 40 too young? I think many people might present with some concerns about facial aging, but feel like that's just too young for them to move forward with surgery. That being said, in the last, I would say 6 to 8 years, one of the largest growing populations for surgical interventions, and specifically for deep length face necklace, are patients in their 40s. A lot of people are interested in doing something to address soft tissue laxity earlier, what some people might call an early maintenance surgery. That's been written about, and honestly, they're some of the most rewarding and kind of exciting cases, because I mean, these are people often come in and they're like, listen, I know what I want, sort of one and done. I just want to do this, move on, and go live the next 10, 15, whatever years, not worrying about it. So those patients are great candidates. Is 50 just right? Sure. For someone who's ready to move forward with surgery, it's a great age to pursue it. But we do have patients in their 60s. We showed some patients in their 70s that have excellent outcomes. And I think part of that's the consult. There's 50 can present many different ways, 60 can present different ways, and 70 can also. So there are patients in their 70s who are still going to be great candidates for the surgery, depending on the collagen and the elastin and their overall integrity and their overall health. So that's part of our job, is kind of analyze and set realistic expectations, with anyone that's in front of them.
This is a fun fact. I think Dave, tell me if I'm wrong. I'll give you the range. I think the oldest patient that we've done a facelift on is 87. And then the youngest is 31. And she had very unique anatomy. I think we hemmed and hawed about making sure we were making the right decision for that patient, because she was on the younger side, and she had an outstanding result. So it really comes down to an individual case-by-case basis when you're right.
Yeah, and I think we are always trying to be guided by an appropriate ethical compass when trying to make these decisions. Of very personalized decisions. Everyone's unique circumstance is different, and I think we take it seriously, trying to help people make decisions that are safe for them and appropriate.
Okay, I think we're going to go on to the beauty bank. So, I think the time is winding down. It's midnight tonight when the clock ticks. 8 a.m. Madison's correcting me. 8 a.m. tomorrow when the gates close. So take advantage of probably our best special of the year. I think it's great because it allows patients to plan longitudinally. I think that's going to be a focus of this year's beauty bank, because we have so much technology. We have a great bank of providers, and you can really kind of get the best best value. So there's the breakdown of the different levels of Beauty Bank, and we're going to do a giveaway. Our giveaway is a $400 value. It's one of my favorite companies. Shout out to Jenny Smith, Jan Marini, and this is a kit. And I think Steve is going to announce the winner of this. I think these were all pre-raffled beforehand for something. So drum roll, please. And the winner is
Deepa.
Deepa, you are the winner of an awesome Jan Marini kit. Thank you for tuning in and spending your evening with us. The second giveaway, and these were all beautifully prepared by Yolanda. And if she ever leaves, well, maybe this one. I know a lot of these were. If she ever leaves us, she has a career in gift basket presentation.
If you guys know, she's not allowed to leave.
Okay, so this is Alaskan skincare basket. This has a $450 value. There are 6 products in here and a very futuristic looking bag that comes with it. And you know what? You can convert this into a picnic basket and recycle this for other events. So, Dave, announce the winner for this special Alaskan skincare basket.
Yeah. The winner is Christine L.
All right, Christine L. If it's a Christine L, I know we love you. Maybe it isn't. I don't know, but congratulations on your basket. Okay. And then the last giveaway is the biggest package. It's a $1,700 value. It's a package of microneedling treatments with the skin pen. Is it 3 treatments? 3 treatments. So that's great. I mean, you're going to really get a great collagen boost out of that. It's one of our most popular treatments. You see it all the time in Hollywood. And the lucky winner of that is Lauren R. So Lauren R., make sure you check in with our team. You are the lucky winner of the $1,700 value skin pen microneedling package. I want to make sure everyone knows that tonight we're also, in addition to Beauty Bank, we're offering 20% off all of the medical grade skincare products that we carry here at L&P. We are all very excited about growing that as we open skin next spring. But go to the website forthefacedskincare.com, put in that code that you see up on the screen, and make sure you take advantage of that 20% off. And get your Christmas gifts, your holiday gifts, your Hanukkah gifts, load up. Thank you all for tuning in. Dave, Steve, anything else to add?
That's all. I really appreciate you all being here. And yeah.
If you guys want to,
welcome Dr. Purdy.
Yeah,
We got a lot of exciting
consult with Dr. Purdy, and you can't wait to get on our Dave and I schedule. And we all 3 of us share a brain. We're really, really excited to have him around. And thanks for tuning in.